Aldous Huxley said it best, the goal of all of us is to die young. We just want to do it as late as possible. And that's what walking every day helps you achieve. So what can we do? Well, as a family physician, I believe we need to include a walking prescription in all treatment plans. With every patient, every visit, every treatment plan should include a prescription for walking. I believe we all ought to use an exercise vital sign. Every healthcare provider should ask a patient about their exercise habits and make a proper exercise prescription. I think we've got to merge the fitness industry with the healthcare industry. Why does fitness operate so far away from healthcare? We've got to merge the two, because I would submit that fitness has the greatest contribution to healthcare. More than anything else we could do is merging that together. So at Kaiser Permanente, as was mentioned, we have been using an exercise vital sign now for several years, and it's been very successful. We ask each patient, as they're roomed, the medical assistant asks them 2 questions. The first is, on average, how many days a week do you do moderate exercise, like a brisk walk? The assistant then clicks 0 through 7, corresponding to the patient's answer. And then the follow-on question is, on those days, on average, how many minutes do you walk at this intensity? They click 10, 20, 30, 40, so on. The computer then multiplies the 2 together to give us a minutes per week reported exercise. And in adults, we want them to say they're doing 150 minutes or more a week. And if they're not, a best practice alert flags that just reminds the physician to tell the patient it would be very important for you to try to increase your walking. It automatically then prints out the minutes per week walked right into to each note for that day on that patient. And as George mentioned, we've begun using walking prescriptions. We have these prescription pads in the room, so we can sort of symbolically prescribe this to a patient, and we use it as the first-line medication. Rather than starting them on a blood pressure medication, let's first start with a walking prescription, and it's when that doesn't work that we then go to medication. Now, I wanted to be sure that I emphasize walking is not the only formulation. But this is the reasons I think it is the best formulation. It's extremely accessible. It doesn't matter your age, fitness level, ability. Walking is very accessible to everybody. You can do it alone or in groups. It's very low cost, does not need specialized equipment or a gym. Walking is very measurable. I can assign a patient how much to walk either using a pedometer, a stopwatch, or just giving them a distance to cover when they go out for their walks. It's the most common adult activity that has very good long-term adherence. Patients who start a walking program are more likely to continue with that than virtually any other exercise program I may give them. Walking is also proven. There's been multiple studies, some of which I've mentioned. All have centered around walking as the formulation of this drug that improves health, so we know it has proven benefit. It's also cost-saving. We get cars off the road. It's a very green initiative. So there are a lot of reasons that walking is the default exercise prescription, but again, it doesn't have to be the only formulation that is used. Now, how fast do you need to go to get these health benefits? I love this study by a clever group of Australian researchers who wanted to answer the question, how fast does the Grim Reaper walk? Because we know for years that walking speed correlates with mortality, so they looked at over 1,700 Australian men. They measured their walking speed in a short distance, and they then correlated that with mortality over a 6-year period. And what they found is the Grim Reaper walks about 2 miles an hour. In this group of patients, nobody who walked over 3 miles an hour died in this group. So we know the Grim Reaper walks 2 miles an hour. As long as you stay faster than that, keep it around 3 miles an hour, you have nothing to worry about. Now, beyond that, I've found it just anecdotally in case after case that I see in my clinic, the power of walking can be dramatic. This is a patient of mine, Valerie, who has end-stage Parkinson's disease. And she came to me several years ago with really in very declined condition. And any of you who have seen Parkinson's patients know that over time the medications stop working, and that's where Valerie was. They were no longer working. She came in on a walker, very weak, obviously depressed. Later told me that she had pretty much given up. She'd seen the neurologist multiple times. There were no more medications to use. And I convinced her to go see a fitness professional that I work with who's down the street from my office, and they put her on a treadmill, starting at 1 mile an hour. She held on. They had to hold on to her. She came back 3 days a week, and each day they turned up the treadmill a little bit more, a little bit more. They did some light weight training with her. Within about a month, she was back in my office. The walker was gone, makeup was on. She was a completely different person. And it occurred to me, if this had been a pill or a procedure that we had given to Valerie, this would have been on 60 Minutes, because the before and after effect was so dramatic. But I think we just tend to brush over this when the drug is something so simple like walking. Now, we're also using walking in the hospital. We realize that virtually every hospital-related complication is reduced by getting patients to walk. Lengths of stay in the hospital are shorter. So what we have begun doing is placing a monitor around the ankle of each hospital patient so that when the doctor comes into round in the morning, they know how many steps that patient has taken. So what we see is this little sensor tracks each step that in turn is fed into our computer, and we get a printout of their walking for the previous 24 hours. So when the physician comes in the morning to round, it's written on the grease board in the patient's room. Yesterday, your patient walked 20 minutes, took 1,235 steps. And the goal is that we know if we get patients to walk more each day in the hospital, we're going to reduce complications, we're going to reduce length of stay. It's a powerful medication both inside the hospital and outside the hospital. So to summarize, as a practicing family physician, it's very clear to me that the benefits of walking in the treatment and prevention of chronic disease is absolutely irrefutable. The evidence is also overwhelming on the cost and health burden of being sedentary. We have got to change that. Walking is the vaccine we need to prevent and treat chronic disease. We've got that. We know it works. We've got to figure out how to better administer it. And I believe that walking should be assessed and prescribed at every visit, that all physicians should use an exercise vital sign to question patients about their walking habits. This is like a drug. We need to prescribe it, and I'm very happy to be here today to join in this movement to get it done. Thank you very much.